Who want to do inauguration? No one, Dr. Jia, you want to do?
I can do
Okay,
it.
we can do it. Okay, good afternoon. So,
Yeah.
suppose she is a girl, she's Sarah, 4 year age old girl. Her mother has a concern, she has some rash on her bottom. And now you have to take the history. You are a ST3 doctor. I'm the mother, I'm Fatima.
Sorry, I didn't get her name.
She's Sarah. I am her
Sarah.
mother, Fatima.
Okay. She's had a rash in her bottom for okay, for your
Do you
age.
understand
So
now?
yes. I'm just trying to gather my thoughts together. So can I have 1 minute to prepare?
Yes, yes, of course.
Thank you.
So squint come in Kolkata. Also, I have seen the history, but I don't know the squint. What is the diagnosis of squint? That history come.
I know the diagnosis. Actually, it's retinoblastoma.
Okay, it's actually come on my mind. Squint DD can be
Yeah,
tumor. We
yeah,
can exclude that. And also
yeah.
squint normal. Normal child can be squint. Any trauma, our DD come from squint. And what are the DD come from squint?
Uh, for squint, any refractive errors, retinoblastoma.
Okay.
The history also mentioned white eye reflex. So white eye reflex, along with the squint, a 9 months old baby is most likely retinoblastoma. If there
Yes,
is no
less than
history of
2 years
white eye
age old
reflex,
is retinoblastoma.
yeah.
Two
If there
years
is no
age is
white eye
what?
reflex, yeah.
Okay.
Please go on.
No, no. You tell me what you want to discuss.
Yeah. I wanted to tell if there is a white eye reflex in any child, in a 9 months old child or in a 1 year old child, then we have some differentials like we have retinoblastoma, we have Coats disease, primary vitreous hemorrhage. That's are the differential for the white eye reflex. And in this child, there was white eye reflex as well as a squint. So this is most likely retinoblastoma.
So it was not repeated, right? Before actually, I have not seen.
No,
Anytime
no,
it come.
no. It was the first time. It is the first time because actually I work in oncology. So I have seen like the cases coming up with leukemias and lymphomas. In Pakistan, it also the case came with leukemia. Okay, so but I have seen a recall osteosarcoma once in the history, and yesterday, yeah, like 2 days back, the retinoblastoma. So it is the first ever that retinoblastoma have come.
Actually, what happened in exam time, brain working is one thing. I don't give everyone brain need to work now. We are
Yeah, yeah,
thinking that recall question are coming. Though my brain first comes squint that is tumor, and if child
yeah,
age is 9 months, then of course it is going tumor.
yeah, yeah.
Okay, next doctor, are you ready? Then we
Okay.
can start.
Yes,
Hmm.
ma'am. Yes, ma'am.
So
Okay. So hello, Fatima. Um,
hello.
I'm Dr. Bless.
I
I'm
think
Dr.
1 minute
Blessing.
after we can start. Azan
Can
is
you
going
hear me?
here. You just
Sorry?
30 second wait.
Yes, I can wait.
Okay, 30 second.
Okay.
So I think you can start.
Okay. Okay. Hello, ma'am. Good afternoon. My
Good
name is
afternoon.
Dr. Blessing. Yes. Am I speaking with Fatima, mother of Sarah?
Yes, yes. I'm Fatima. Sarah is my baby.
Okay. All right. So I'm here to ask you some questions. I see from your notes you have some concerns with Sarah about a rash. Can you tell me about this rash?
Actually, Sarah has some rash on her bottom. That is my main
Okay.
concern. That's why I'm here.
Hmm. Okay. When did you notice this rash?
Like last 1 month, she's suffering this problem.
Okay. This rash, is it itchy?
Yeah, yeah, it's so much itchy. Even she can't sleep at night.
Mhm. Okay. Is it increasing in size?
Yeah, increasing. Yes, the day by day it is increasing the itchiness. That's why
Mhm.
I'm here.
Okay. Oh, okay. Is there any fever? Does she have any fever?
No, she has no any fever.
Okay, so it's just itchy and increasing in size.
Mm.
Is the area red? Does it get reddened or warm
Yes,
to
yes, it is
touch, warm
red.
to feel? Okay.
Yeah,
And does it feel
no,
warm?
no, there is no worm I have seen.
There's no warmth. No, I mean when you feel it, does the area feel hot when you feel it with your hand?
Yes, hot.
Okay, okay, okay. Can you tell me about her how she cleans up herself after she poos?
Yeah, using that wet tissue and I'm from back to
Okay.
front. I'm
Oh,
cleaning.
from back. Okay, okay, okay. And who does that for her?
Hmm?
Does Sarah do that herself, or are you the one that cleans her up?
Yeah, I do that.
You do that, okay, okay. And uh, have you I mean, does anybody apart from you, does anybody who gives Sarah her baths, or in the when she has to take a bath, who does that for Sarah?
I have given.
Okay, just you alone, mom.
Yeah.
Okay. And has Sarah said anything about
Hello.
anybody touching? Has Sarah mentioned anybody touching her bottom to you at any time? Any other person?
Actually, I go on job. That time she may be on my neighbor house, or otherwise I don't think.
Your Okay, your neighbor house. Okay, and but Sarah never tells you about neighbor or anybody touching her bottom.
No, I don't heard that this anytime.
Okay, okay. Um, have you done anything about this rash? Have you applied or done anything about it before coming here?
Yeah, I have given some cream, but it's not improving.
Or we gave some cream? And then may I know the name of the cream that was given?
That is for diaper rash I giving.
Oh, for the upper rash. Okay, okay, okay. But there was no improvement. Oh, all right. Um, in addition to that, does she suffer any fever?
No, double question.
Mm,
Okay.
is she losing weight? Any weight loss?
No,
Okay. She complained of headaches recently.
no,
Mm,
no,
yes. Any cough? Any cough
no,
or difficulty breathing? Mm.
no,
This rash, is it just on her bottom or other parts of her body?
no, only bottom.
Just bottom.
Hmm.
Does it bring out anything, any discharge from the rash?
No,
No. Okay. Does Sarah complain of pain in her joints
no, there is no pain in
or muscle pain, body pains? Okay. What
no,
about does she feel her heart beating, or does she get tired easily?
no,
Mm. Um, any diarrhea?
no, there is no diarrhea.
No diarrhea. Or constipation?
Yeah, yeah, there is a very much constipated Sarah.
Mm. Okay. And Good. Like how many times does she poo in a week?
2 times
2 times.
or
Is
one
the
time
poo
sometimes.
hard or okay? Is
Yeah,
it
yeah.
hard or
Yes, it's
it's
very
hard?
hard.
Okay, it's very hard. Okay. Does she feel cold or get? Does she feel cold easily?
No.
Okay. Yeah. All right. So can you tell me about any past hospital admissions? Has she had been admitted in the past
Yeah,
recently?
once she had admitted in the hospital when she was 2 years age old. I remember that something, cough for that.
Okay, just cough.
Hmm.
Okay, okay. And apart from that, how long did she stay in the hospital?
I think 3 days.
3 days. Okay. And what about any surgeries? Has she had any surgeries in the past?
No.
Mm. Does Sarah suffer any drug allergies?
Uh, no, I don't think.
Mm. Then, or is she on any medications
No.
for any condition? Okay. Uh, okay. Can you tell me about Sarah's pregnancy? Were
Yeah,
there
it
any
was good,
challenges during her pregnancy? Hmm.
No, there is
Okay.
no
So
challenge.
all
It's
her
just
scans
normal
were normal.
delivery and
Okay.
yeah.
All her scans were normal. Oh, okay.
Yeah,
What about
all her
delivery?
scans
How was
normal.
delivery? Okay.
It was
How was her
uneventful.
delivery? Was it uneventful? Okay. And
Yeah.
how long did you stay in the hospital before you were discharged home with Sarah?
The day they discharge us.
Or yes, when were you discharged? Was it the next day or how many days did you spend in the hospital after delivering Sarah?
No, we have not passed any. We just that day come home.
Oh, just that day. Oh, okay, okay. And Sarah passed her newborn hearing tests, and there were no other complaints in the newborn
Yes,
period.
yes, yes. She passed.
Mm. Were there any developmental concerns, delays in Sarah's development?
No, I don't notice anything. She's developing, I think, nicely.
Okay, okay. And um, tell me about home. Where is Sarah's father?
Actually, he is a driver. He's doing job.
Hmm,
Maximum time
okay,
busy outside home.
okay, okay. And does Sarah have any other siblings?
Yeah, she has another sister. She is Marwa. Marwa also have same problem.
Mara,
She is
okay. I was
six
about to
years age old.
ask that. 6 years. Oh.
Mm.
And Marwa also has, is the rash still on Marwa presently as we speak?
Yes,
Okay. Do they, sorry to ask, do they share underwear?
yes.
Mm, okay. Um, so just both of them and you, mommy, you mentioned that you work. So when you work, who stays with Marwa and Sarah? Who takes care
I
of them?
I send them to the neighbor house.
To the neighbor house, okay. And for how long do they spend there before you come back home?
2 3 hours. I do
Like,
part time job.
oh, okay. So 2 3 hours they spend in neighbor's house, just to
Yes.
be sure, or before
Mm.
coming. And can you tell me about neighbor's house? I mean, how many children are there in neighbor's house?
And my neighbor has one children. She is also a girl.
We just okay, okay, just one girl. How old is the
Yes.
child?
The girl is 3 years age old.
How old is? Sorry,
3 years age old.
I think 3 years old.
Mm.
Okay, okay. And does neighbor's child also have similar rash?
No, 9 minutes.
Okay, all right. Okay. Does Sarah go to school?
Yeah, she started her nursery.
Okay. Any similar events in any other classmate of Sarah that has been reported?
No.
Hmm. Okay. Uh okay. So yeah, so okay, to get you right, you say Marwa and Sarah have this rash. Um Sarah goes to nursery. Am I right on that?
Yes.
Okay. Okay. Um, so do you have any other concerns about Sarah that you would like me to address?
Yeah, and to that she get rid of this problem.
Yeah, I can understand that. I can understand. And I just want to reassure you that we'll do our very best to get to the cause of this rash. Of this
Okay.
rash. Yes, thank you very much.
You're most welcome. So, what is your diagnosis? And please present your case.
Okay, I have interacted with Fatima, mom of 4-year-old Sarah, who has presented with a rash, which is itchy and has been increasing in size. Itch, itchiness is mostly at night. Um, and this most likely may have resulted in constipation. Also, rash is present in Sarah's sister, Marwa, 6-year-old Marwa, who also has same rash. Children spend some of their time with neighbor when mom is away at work. My diagnosis is most likely um, due to pinworm. I'm thinking of pinworm infestation, the worm infestation, because the rash is mostly itchy at night. Um, I'm also, yeah.
So, another cause is constipations, pinworm
Other
infestations, and
causes, I'm
child
also thinking, yeah,
abuse
I'm
can
also
be
thinking,
happened because outside of the home, he spend time
sorry?
there. Outside home, they spend time. So, child abuse also one of the DD come.
Yes, yes.
Okay.
Child, I'm thinking other differentials. I'm thinking child abuse. I'm also thinking poor anal hygiene, maybe from the constipation.
Mm.
I'm also thinking it could be a streptococcal rash.
Okay.
A,
So
a
first of all,
streptococcal
that
rash.
history, you take the history analysis on the beginning. You get lots of time to decorate the history. You have not taken
Yes,
the nutritional history, not vaccination history. You have not asked. Nutritional history is here important. I am telling she is suffering constipation. If you ask me her diet, then I will tell that she is chocolate. She not interested to eat, drink enough drink
oh
or
yes, that's true.
vegetables, fruits. So nutritional history had important. Jab you can ask the vaccine history. One line you can ask. Another in school you
Okay,
have not asked any bullying history because she has constipation. There is soiling present. There is bullying present. If you ask me, then I will mention that this point. Yes, that her friends are ignore her or bullying issue they are present because there is a bad
okay,
smell coming from Sarah. And another
yeah,
thing, first you analysis the history. So this is rash, onset, course duration, what make it better, worse, itchy, not itchy, describe the rash, anything, everything you ask. But you go the systemic review, then you return back to the present illness, and the rest you again ask 2 or 3 lines, right?
yes,
That is one like haphazard on go. And another on the
mm,
birth history. Actually, I am telling you, you are asking me on my, uh, but you have not asked when he passed the first poo. That is also needed to ask is that a heart-sprung disease or anything. And another DD, it can be Crohn's disease. Anal ulcer present. So you need to ask that any oral ulcer present or not. That is, you need to ask. Family history, you need to ask that his father, mother, anyone has a poo-related problem or not. Yes, family history can be positive, can become. So this point is actually important. You need to ask
yes.
all these things. Otherwise, okay. Analysis. Oh, you have not asked about the diaper. When I change the diaper, time of changing diaper, that is very important. Constipation details, pain during poo, any blood during poo, how long constipation is going on, then constipation related the feeding. That is everything you need to ask because hair constipation is one of the cause. That is
Yeah,
explanation is needed much more. So treatment is management is first of all it would go on constipation. That is we education we give parents education about diet modifications, potty training, everything we will discuss. Then we'll examine the with consultant NAS examination we will do because if anal stenosis anything heart anal stenosis or uh, for constipation we can check or any child abuse present or not. This thing we
yeah,
will do according to we give treatment constipation treatment we give. I have not tell you any allergy but Allergy can be present here.
Yeah, I
Okay.
asked for allergy. You said there was
Yes,
no history of allergy.
you asked that
Yeah.
it allergy. I remember that you asked. I have not asked. So this is all about the history, I think.
Okay, ma.
So another thing, nutritional history, that is, it can be acrodermatitis enteropathica, zinc deficiency, right?
Yeah.
So any oral rash present or not, any alopecia, that is zinc nutritional. That's why diet history is important,
Yeah,
though it is not the cause.
I asked if there's rash on any other part of the body,
Yes, any other part of
and
the
the mom
body, but
said there
you
wasn't any rash.
specifically ask the oral rash. It is important because you need to exclude the
Okay.
Crohn's disease and also the
Yeah.
acrodermatitis enteropathica, especially the nutritional history. They are important because
Okay.
constipation we need to. So we keep on this
Okay.
mind. That's why I am uttering all the word when we take this
Yes.
history. So thank you
Okay.
very much for your participation. I think today we complete 4 station already. Inshallah, we'll
Okay.
meet tomorrow.